welcome back. So today I am going to be talking about skin conditions. If you haven't watched the video on the integumentary system, be sure to go ahead and watch that video before you watch this, because a lot of the terms are going to be, corresponding with that video. Obviously, there's a lot of skin conditions that people encounter. So I'm not going to be able to talk about every single one of them, or else this video would take hours and hours. So I'm just picking the top most common skin conditions that people deal with. So the first one I'm going to talk about is acne. So acne affects the skin. It also affects basically the sebaceous gland, the oil glands. And what really happens is the hair follicles become clogged by this sebum, this oil, and or dead skin cells. And that will result in pimples, zits, there are other terms like furuncles, carbuncles, and, goes on and on. Other causes could also be bacteria. Propionibacterium acne is one of them that can cause it, and other types of bacteria can also cause acne, such as Staph aureus, which is one of the reasons why they say, if you have acne, stop poking at it, because you do have germs in your hands and it's just going to get more infected. And inflammation can also cause acne. And where would it appear? It would appear on the face, forehead, the chest, upper back, shoulders. And this is because in those areas you have a lot of sebaceous glands. So it's no surprise that they will occur there. And acne is more common in teenagers, and hormones definitely play a role. In teenage years, you get a surge in hormonal secretions. So it's no surprise that you're going to have acne during puberty. And also, during the menstrual cycle, a female menstrual cycle, estrogen plays a role. Some women might find out that they have acne when they are about to have their period. Again, play a role in hormone secretion, testosterone in playing a role in puberty. So diet plays a role. Studies actually show that certain foods are carbohydrate rich, like bread and bagels. We all love those. They have, a cause. They can actually cause you to have more acne. Medications also play a role. Stress plays a role. So it's no surprise when you are very stressed, you start seeing a pimple popping up here and there. Stress plays a role. What are the common myths of acne? So out there, people believe, oh, you must have eaten something, that's very greasy, or you eat lots of chocolate. Those are myths. Or hygiene. We see someone with acne and we can automatically think, oh, must be dirty, you don't shower. And that's not really true. Or cosmetics. Oh, it's because you put on too much foundation, too much products in your face. That's what's causing you to break out. Not so much. So those are just the common myths, and obviously, again, there are so many other more. And what are the complications of acne? Acne scars. If you keep poking at it, there will be a scar. Your skin will heal after every healing. There will be a scar. So there's a reason why they say just leave it alone. There will be also skin changes. There could be hyper or hypopigmentation, meaning that area could get lighter than the rest of your skin tone or darker than the rest of your skin tone. And what are the risk factors? Age plays a role. So one of the things, I mentioned earlier, teenage, being a teenager plays a role. The older you get, you realize that you have less acne compared to when you were younger. Hormonal changes, I mentioned that. Family history, some people, if acne, if your dad or mom says, hey, I used to have acne, you're more likely to have it. And you will find situations where parents don't have any acne and their children would not. Greasy or oily substances really on the face. If you're keep touching, we're already talking about oil and you're adding more oil to it. Friction or pressure on the skin, constantly touching your face, having stuff on your face. Those are those are risk factors for acne. So the next skin condition is going to be eczema. The term for eczema is atopic dermatitis. There are various types of dermatitis, so that's why I wanted to make sure I'm talking about atopic dermatitis. I'm still going to talk about contact dermatitis. So what are the signs and symptoms? It's usually going to be a dry, recurring, itchy. The medical term for itchiness is pruritus, so I'm going to be using that word also, and constant. And there might be a rash that develops. That skin will become thick, will become inflamed, and sometimes discolored. If it's on a darker skin tone, it might appear grayish or purplish. If it's on lighter skin, it will appear more red. And this can present early in babies. So, sometimes we think that this is something that happens later, but it can present early in babies and children and may continue until adulthood. But sometimes because it resembles a rash, the first rash on a baby, we should definitely take that into account, because it could be something dangerous. I'm going to talk more about a rash in this video. But what's the cause of eczema? It's really unknown, but it's believed that genetic, environmental factors play a role. Their immune system is just reacting to something, and there are risk factors. So risk factors like allergies. People who usually have eczema are going to have other allergic reactions, and usually the eczema could be a sign that you're allergic to something. So it shouldn't be ignored. So it's not really a symptom on itself, but you should know what is causing me to have this eczema. Hay fever, and people who have asthma also would tend to have eczema. Also, there's also family history. If it runs in the family, I mentioned genetic factors. For one reason or the other, your immune system is just reacting to whatever. So what will be the prevention? Avoid soaps, fabrics, lotions, stress, allergen, basically anything that can aggravate it. So you need to know what is causing. It might take a lot of trial and error, but you need to know what is causing you to have this eczema. You're obviously having a reaction to whether soap, fabric that you're wearing or putting on your skin, certain lotions. Stress could cause it. Allergy like pollen, food allergies, pet dander, dust mites. Most people might just think, oh, that's just more respiratory, but dust mites can cause eczema. Tobacco smokes, studies actually show if there's a smoker in the house, or or tobacco smoke specifically, it could cause acne. Not acne, sorry. It could cause eczema. So cool and dry air can cause it. Fragrances could cause it. So prevention, moisturize daily, use cleanser free of dyes. Studies show that most of these dyes and fragrances that we have in our, laundry detergent, in our lotion, they can actually, cause it or aggravate it. Alcohol dries out the skin, so make sure you're avoiding products that have alcohol, because it's just going to make it worse. And what are the complications? Asthma. So it's no surprise when you go to your doctor, one of the questions they would ask is, do you have asthma? And you're like, wait, what? I just have eczema. But complications, asthma, people who have asthma, like I said earlier, tend to have eczema. It could cause skin infections because you have the open sore. The skin is now exposed. There's no protection anymore. Sleep problems, having to constantly itch throughout the night. Sleep problems, allergic rhinitis, having the runny nose again, allergies playing a role, and all of that could just make someone very sad, depressed. And what would be the treatment? Medicated ointments like hydrocortisone, over-the-counter works, but if it's not enough, your doctor can up that dose to about 2% hydrocortisone. You can't take too much cortisol. I'm going to talk about that way later. And treat allergies and avoid whatever is causing your allergy. We call those triggers. Avoid your triggers, and that will definitely make the eczema go away. The next one is psoriasis. So psoriasis, kind of common, not common. You might have seen a commercial on TV or elsewhere, and this is really a chronic autoimmune skin disease that speeds up the growth cycle of skin cells. So you have a lot of cell turnover. And what are the signs and symptoms? There will be patches of thick red skin, usually could be scaly. If it's in a darker skin tone, it will be more, just really, really dry. And most commonly, this would be seen on elbows, the scalp, around the scalp, the neck, the fingers, knees. Those are the common areas. And with people who have psoriasis, it's kind of embarrassing to them because it looks really bad. It looks like a really bad rash. It looks contagious, but it's not. It's not contagious. So they tend to avoid social gatherings because people are going to be like, ooh, what's that? Why does it look like this? It's just autoimmune, which brings me to the cause. Immune mediated, we don't know. Something's causing these cells to speed up their cycle. Genetic and environmental causes play a role, and the key thing here that's happening is hyperproliferation of keratinocytes. Again, if you haven't seen the integumentary system, go back and look at it, because I talked about keratinocytes, and inflammation is in here. We don't know what is causing this, hyperproliferation of keratinocytes, which is one of the reasons why I might say unknown cause. Triggers stress. When people who have psoriasis or stress, they tend to break out more. Cold and dry weather, tobacco, and so on. So again, avoiding those triggers. Complications of psoriasis is psoriatic arthritis. So this usually accompanies psoriasis. So again, this tells us immune mediated. They tend to have arthritis in their joints, which is associated with psoriasis. Prevention, I mentioned, avoid triggers. What would be the treatment? Medicated creams, hydrocortisone. I forgot to mention that hydrocortisone really is just to decrease that inflammation, to stop that hypersensitivity that's going on in the skin. UV light therapy can also help psoriasis. Medications like methotrexate. What it does is it basically decreases your immune system, kind of like, because again, I talked about hypersensitivity. Your immune system is overreacted for no apparent reason. So these medications is just, okay, tone it down. It's not that serious. And like I mentioned, not contagious. It looks really bad. It looks like, oh my goodness, what is this? But it's definitely 100% not contagious. The next skin condition, skin cancer. So skin cancer, most of the time people talk about melanoma, but I wanted to talk about other types that could easily be ignored because they don't look that scary. And we have three most common types. Basal cell carcinoma. This is the least malignant, but it's the most common. So the picture I have here, you can see the basal cell carcinoma. It doesn't look scary. Most people are just like, it does not bothering me. It's just there, and they don't pay attention to it. It would appear very pearl-like. Has a pearl appearance to it. And what's really causing this is the stratum basale. If you remember in the integumentary system video, that is the bottom layer of the epidermis, the first layer of the epidermis, and that's where proliferation happens, mitosis happens, and this will slowly evade the dermis and the hypodermis. So it's going deeper down. So you're looking at this and it's like, okay, it's not getting bigger. It's just there, but it's going deeper. It's not going to spread wider. It's going to go deeper into the skin. And prognosis for basal cell carcinoma is actually very, very good. Could be cured by surgical excision. The surgeon would just go in, go deep and, take it out, in 99% of the cases, could be cured. The second type is squamous cell carcinoma. This is the second most common type, and this can metastasize, meaning it can spread to other organs. Not just, people think, oh, metastasize like spread on the same area. No, to other organs like brain, liver, and so on. This involves the keratinocytes of the stratum spinosum, which is, the second layer of the epidermis. And we usually see this as scaly red papule on scalp, ears, lower lips, the hands. And another thing I wanted to talk about skin cancer is you're most likely to see it in sun exposed areas. All right. It makes sense. UV radiation in sun exposed areas, you're not going to find it in hidden areas that are not constantly exposed to the sun. Melanoma is the one we usually hear about. This is cancer of melanocytes. Melanocytes are the one responsible for your skin color. They produce melanin. This is most dangerous, highly metastatic, and very resistant to chemo. That's really, why it makes it, why it's so dangerous, because some people might be like, oh, I'll just go get chemo, but it's resistant to chemo. And the picture I have here of melanoma, it can look like this and it can already be spreading. So it doesn't need to get bigger than this. It doesn't need to get worse than this for it to be considered dangerous. Because sometimes people will say, oh, I'm just monitoring it, it's not bothering me, maybe for cosmetic reasons I might have it removed later, but it could be dangerous right now. So this is treated by wide surgical excision and immunotherapy. And the key to survival, we use the ABCD rule. A for asymmetry. Are the borders symmetrical? If they're symmetrical, great. If they're asymmetrical, not a good sign. Are the border irregular? Do they have indentations? If they do, not a good. Color, it shouldn't have, if someone has a mole, for example, it should just be one color. It shouldn't have multiple color like brown and black and blue and purple. If it starts having multiple color, that's a bad sign. And the diameter, if it's greater than 5 millimeter, that's bad. What's the size of a 5 millimeter? The size of a pencil eraser on your number 2 pencil. Someone might be like, what? Yeah. If it's bigger than that, then that is a very, very bad sign. So the next one is going to be contact dermatitis. So contact dermatitis, the word contact, you have to have contact with something that you're allergic to. So there's going to be inflammation and irritation of the skin. This will appear hours to days after the contact. It may be less noticeable in darker skin tones. What would be the cause? Again, most of the time, 80% of cases, it's due to contact. Like belt buckle, the person take off their belt and there's a rash at whether it's the leather, the belt buckle touching their skin, or certain jewelry, some people have allergy to cubic zirconium if they wear that earring or on their body parts, or it could be another cause, could be allergen. So the clinical manifestation is that it's going to be if it's an irritant, hyperemia, meaning that it's going to be very red, it's going to be itchy, there's going to be a lot of pruritus, skin lesions, and if it's the cause is due to an allergy, you're going to have hives. And diagnosis, use test. What does that mean? Use it and see, is this what's causing me to be allergic? Is this what's causing the rash? You would not know what's causing the rash unless you use it. And we can always, advanced cases, do a skin biopsy. Treatment, avoid the cause and use hydrocortisone cream. So vitiligo, I don't know, maybe it's me, but I feel like I'm seeing vitiligo a lot more than before. So the exact cause is unknown, but obviously it's immune mediated, meaning autoimmune. Their immune system, we use body, but immune system is attacking their melanocytes. We don't know why, So this will result in loss of melanocytes. This could be in the skin, hair, mucous membrane. Mucous membrane is like where, moist area in your mouth. So in your mouth, oral mucosa, nasal mucosa. And this will appear milky white or chalk white, hypopigmented patches. You can see it's a lot lighter than their patches, lighter than their regular skin tone. We're going to see this in hands, arms, trunk, feet, and face. So these are the common areas we're going to see vitiligo. And treatment will be steroid therapy, medications, immune medications. In terms of immune, we're really targeting, again, it's immune. Their immune system is, they wake up one day and your immune system is like, oh, I don't recognize melanocytes, let's destroy it. So we just have to be like, okay, we can't stop it from doing that, but we can tone it down. Light therapy works, and sunscreen, because now those areas don't have melanocytes anymore. So we make sure you apply sunscreen in those areas. Hives, also called urticaria. These are itchy welts. They have pale wheals or papules that cause severe itchy. The cause could be reactions to drugs, contact with allergens. It could be emotional stimuli. Some people, they're, emotionally, something happens and then they have hives. And the pathogenesis is IgE. IgE is one of your immunoglobulins that releases histamine. You tend to see increased IgE in allergic reactions. Diagnosis, allergy testing, skin biopsy. I have in the previous slide the allergy skin test. They can also do a blood test. The skin test is something that could be done in the doctor's office. And the treatment would be antihistamine, because histamine is being released, so you take antihistamine like Benadryl, and calamine lotion to just decrease that or stop the itchy, and cortisone cream, again targeting all that inflammation. The next one is rash. So rash is a general term we use to describe an irritated or swollen skin. It's itchy, it's red, painful, irritated. It's not really, if there's a rash, don't just, go to the store over the counter and get something. This should tell you, more investigation needs to take place, like what's causing this rash. So that's why I say that it's more of a symptom of different medical problems than an actual problem itself. And the cause varies. The cause goes from infection. If you have an infection, it could be a fungal infection like ringworm. If it's a virus infection like herpes zoster, like chickenpox, shingles, measles, those are, viral infections. Irritating substances like contact dermatitis, or allergies like soaps and lotions and fabrics like I mentioned earlier, or a tick bite could cause rash like Lyme disease. If there is Lyme disease, there will be other symptoms associated with that. I will talk about, I'll be talking about Lyme disease in the future. And autoimmune cause like lupus, systemic erythematous lupus, systemic lupus erythematosus, that's short for, that's the long word for lupus. People who have lupus, they have what we call a butterfly rash on their face. Psoriasis, I mentioned psoriasis, that's also rash. Eczema, so you can see rash could be, have many causes. And the last thing I'm going to talk about today is dry skin. So dry skin, people deal with dry skin called xeroderma, especially in the colder months like winter, fall. And this is when the skin does not have enough moisture to keep it soft. So what ends up happening is that you have rough patches that flakes or look scaly, or it might crack and bleed. And the skin may turn red or darker if in a darker skin tone. It may or may not be itchy, all right? If it's like on your lips, it might not be itchy. And types of dry skin: contact dermatitis, eczema, seborrheic dermatitis that we might see in cradle cap, And what would be the risk factors? Dry or cold climates, washing hands frequently. So occupation plays a role. If you're a hairdresser, your is constantly in water, you work with food, you will more likely have dry skin. Allergies. Age. As you age, you will tend to have drier skin. There are certain health conditions like diabetes, that could also be a risk factor for having dry skin. And what would be the treatment? Moisturizers. Using moisturizers that have petroleum jelly and certain oils like coconut oil and shea butter, all of those, cocoa butter. Those oils help sealing the moisture. And also avoid products that have alcohol. Alcohol tends to dry out the skin. Stop smoking because nicotine dries out skin. Use humidifier to moisturize the air around your skin. So those are the top skin conditions that I'm going to be talking about. If, in the future, I might talk about more skin conditions. So that would be it for today. All right, thank you. Bye-bye.